we are working on a gene replacement therapy, trying to deliver CDKL5 DNA sequence coding for CDKL5 to the brain, which then would help to produce CDKL5 protein and restore proper cell function. So we're pursuing an AAV-mediated approach using AAV basically as a delivery vehicle to get the CDKL5 DNA inside cells. Our route of administration of choice is through the CSF, so it's a direct delivery into the cerebrospinal fluid, using mostly AAV9-like capsids, but also exploring other serotypes at this point, because it's still not completely clear what the best serotype, AAV serotype is to get widespread distribution and expression in the primate brain. So we think that our route of administration is likely safer than systemic IV approach, because lower doses can be used. Right now, even using some of the improved blood-brain barrier penetrating capsids, you still have to use quite high doses. And so those high doses will then still potentially cause a problem by having accumulation of your AAV capsid, for example, in the liver. So our research has shown that we can achieve good efficacy with our gene therapy product in a CDD mouse model. We have focused so far on younger mice. That's more for practical reasons, because the injections are easier. And the effect, the improvement effect on behavior rescue in those mice is much stronger when you treat younger mice, of course. But as I mentioned, we've also been working on slightly older mice and juvenile mice where we see a similar efficacy. What we're working on right now is really translating that research into clinical research by using non-human primates as an intermediate. So non-human primates are very popular for gene therapy translational research because they have many of the anatomic features you would find in a patient, and the brain is obviously substantially larger than in a rodent model, but yet not as large as you find in patients. So we're working on optimization of the route of administration. There's a few ways how you can actually get it in the CSF. It's more an issue of medical technology than really of research. And then, of course, you need to optimize the dose and other parameters like the injection volume. The primary readouts are really here. One thing is the vector distribution, the AAV itself, where the capsid actually goes, both in the short term and in the long term. And then, of course, what do we get in terms of expression profile of CDKL5 in the brain? And so those are really the two things which are really important right now, and we're really working on. We've looked also into safety and toxicology studies a little bit in non-human primates, and fortunately, we really have not seen anything which would raise any red flags. So CDKL5 seems to be really well tolerated when added to a wild type monkey.